a warning for women considering laparoscopic surgery for a hysterectomy or to remove uterine fibroids. Joining us right now is Dr. Jessica Shepard, Assistant Professor of Clinical Obstetrics and Gynecology at the University of Illinois College of Medicine. Thanks for joining us.
Absolutely.
So let's talk about the surgery, because laparoscopic surgery, as I think, is a good thing, right? Teeny tiny scars.
Small incisions, minimally invasive. You go back to work much quicker. Decreased blood loss, quicker recovery, less pain.
So then what's the warning?
So the warning doesn't have to do with the type of surgery, it's the actual device, which is called a power morcellator. And during these small incision surgeries, the way for us to remove specimen from the abdomen and the pelvis is to use this morcellator, which takes pieces of the tissue from the abdomen and pelvis and removes it from the body. And that's how we actually perform that procedure, and that's where the risk now is being involved with the FDA warning.
And the concerns are that what?
So the FDA recommended that the use of the power morcellator may be discontinued or discouraged, rather, because we had patients that have had bad outcomes, who have had cancers that were undiagnosed and had these procedures, and then using power morcellator to remove the tissue now spread the cancer. And so that is a bad outcome for patients, which ultimately healthcare professionals and physicians do not want for their patients.
Okay, so people are going to hear that, and people who have already had this surgery are going to start to get really, really nervous. If you've already had this surgery, should you be concerned?
So the concern comes with the actual pathology of the tissue that's removed. So most people who have this surgery have already been back to their doctor after the surgery, and they've already gone over the pathology and the results of what's been taken out, and they know that if there was a cancer concern, that would have been dealt with. But most times the procedure that's done is fibroids that are removed, and fibroids are non-cancerous. They're benign tumors, and they're very common in women. 50% of hysterectomies that are done in the United States, and up to 600,000 are done a year, 50% of those are done because of fibroids. By the age of 50% of women will have fibroids. For African Americans, 75% by the time they're 50 will have fibroids.
Yeah, and they can be very uncomfortable for women. So if you are concerned about this sort of surgery, though, if you're one of the women who may be at risk, and what would put you at risk? Well, who should not?
So the type of cancer that this is, it is very aggressive and it's very fast growing. So if there's a concern that there's a growth and it's very fast and rapid growing, that is a concern. That's a risk factor. If you've had any pelvic radiation, that's a risk factor. And also taking tamoxifen for use for breast cancer patients, that is also a risk factor as well. So if you have a fibroid, which is typically a very slow growing tumor, and you have that's growing very fast, that's something that you want to concern and talk to your doctor about. But those that are slow growing, those are the usual growth patterns of fibroids, which again are non-cancerous.
So if you find yourself in that group, that small group that may be at risk, what are your alternatives?
So your alternatives are, the issue with this, again, is the power morcellator. But if you do have this type of concern, you're going to want to see a gynecologist, oncologist who deals with cancer. And typically those procedures will be done with a large incision similar to that of a cesarean section. So the issue with that, again, now for cesarean section and larger incisions, there still is a risk of spread of this type of cancer. So again, it is a very aggressive type of cancer. But what we're looking at now, again, is the device that's used, which is the power morcellator. And if you do suspect that you may have this type of cancer, is consulting your physician and talking about your options. Is this the type of procedure that should be done for you? And what are the other alternatives, like you were discussing, for these types of patients?
Dr. Jessica Shepard, thank you so much for joining us.
You're welcome.